Hello friends, welcome back to our channel NEET Biology Expert. I am Dr. Parveen. In this lecture series, we are studying Class 12 Biology, Chapter Reproductive Health. In this particular lesson, we are going to study about cervical cancer. What is cervical cancer? What is the causative agent? How it occurs? What are the symptoms? What are the different diagnostic techniques and treatment and preventive measures? So these are the things we are going to learn in this lesson. Right. So first, what is cervical cancer? It is the type of cancer that occurs in the cells of the cervix. So we know cancer, right? Cancer is an abnormal growth of cells or tissues that could affect any part of our body or any organs. So similarly, if the cancer occurs in the cervix, that is called cervical cancer, right? So what is cervix? Cervix is the lower part of the uterus that connects to the vagina. So look at this picture. This is a female reproductive system. And here, this is the uterus. And here we have the vagina. So cervix is the connection between the uterus and the vagina. So we could simply say the mouth of the uterus is called as cervix. Okay. So if the cancer affects this region, this is called as cervical cancer. Right. So what is the causative agent for the cervical cancer? This is caused by a virus that is called as Human Papilloma virus. In short form, we call this as HPV. This is very, very important. Human Papilloma virus is the causative agent for cervical cancer. We know that human papilloma virus is a sexually transmitted infection. There are many viral infections, for example, hepatitis B, AIDS, like this. These are all sexually transmitted infections. Okay, so one of those sexually transmitted viral infection is caused by human papilloma virus. So this virus also could able to cause cancer. But here we should remember that it is not a single virus. There are various strains of human papilloma virus. Strains means many types, many subtypes are there. Okay, so various strains of human papilloma virus, they play a role in causing the cervical cancer. Okay, so whichever human papilloma virus causing the sexually transmitted infection generally won't cause cervical cancer. Cervical cancer will be caused by different strains of human papilloma virus. So what happened here? Here, in the human papilloma virus cause an abnormal growth of the cervical cells that we call as cervical dysplasia. So look at this picture. Here, this is the uterus, okay, and this is the vagina. So here, the connection between the uterus and the vagina, here, this region is the cervix. So we could see here, there is an abnormal growth of the cells. So this is cervical cancer. This is caused by the virus, human papilloma virus. Okay. So here, what happens exactly? The virus causes a condition called cervical dysplasia. What is cervical dysplasia? This is an abnormal or precancerous cells in and around the woman's cervix. So usually we know that in cancer means there will be abnormal or uncontrolled cell growth will be there. That is generally called as cancer. Okay, similar thing happens here. Here there will be an abnormal or precancerous cells development will be there in and around the region of the cervix. So that is called as cervical dysplasia. So here look at this picture. This is cervix, that is the opening region. So if this structure is normal, it looks like this. And if this structure is abnormal, that means it has cancerous growth, then it will appear like this. Okay. So why the cervical dysplasia or why the cervical cancer occurs? Because this virus enters the body, and what happens? We know that viruses are obligate intracellular parasite. That means they could not able to survive outside the human tissue. They need a human cell or a host cell, right? Similarly, this human papilloma virus once enters the cervix region. Okay, so if suppose this is a cervix cells, okay, cervix cell. So what happened? The virus, it mixes its DNA or genetic material with our host cell. Okay, so then the virus takes over or completely hijack the host cell and keeps the cell under its control. So after that, our own cell stops multiplying or stops producing our own mechanism or our own functional system. So it is now under the control of the virus. So now the virus instructs the cell to grow indefinitely. So as a result of this, this cervical cell grows indefinitely without any control. It grows. So and it forms a mass of the cell. That mass we call as tumor or cancer. Right. So exactly what happens, the viral DNA when gets inserted with the host cell DNA, it causes mutation. It causes mutation. That means it causes some changes in the nucleotide molecules. Okay, we know that adenine, thymine, guanine, cytosine. So these are the nucleotides, right? So when the virus inserts its gene, inserts its DNA with the host cell DNA, that time it causes mutation. So as a result of the mutation, the host cell loses its normal cell cycle or normal growth cycle. So then it starts growing abnormally. Okay, so that's why cervical dysplasia or cancer stage forms. So here, who will get the cancer? Not every woman who has this human papilloma virus will have cervical cancer. Only a small percentage of the people infected by the virus will develop the cancer. Because the virus, it remains and survives in the woman's body for many years. It keeps in a silent mode. Okay, so it waits for a suitable environment to start multiplying. So till that it keeps in a silent mode itself. Okay, so the virus survives for many years without causing any infection, and suddenly it causes the cervical cell to become a cancerous cell. That means suddenly it causes mutation in the host cell. Okay. So as a result of mutation, what will happen? As a result of mutation, the mutated cell grow and multiply out of its control. So this abnormal growth results in the formation of tumor. Okay. Now, sometimes what happens here, this cancer cell, they invade the nearby tissue and spread. So that is called metastatus. So here the cancer originates in the cervix. Not only in the cervix it affects. What happens once the cancerous cells grows, they start to invade, affect the nearby cells. Okay, then the next stage, the cancerous cells get mixed with the blood and it travels through the bloodstream and they go and settle anywhere in the body. So in which region it settles, from there it starts growing again. So the cancer develops in that region. For example, the cervical cancer originates in the cervix. If it gets mixed with the blood, travel through the bloodstream and go and settle in the lungs. Now the lung cancer develops. If it go and settles in the gut, the intestinal cancer develops. So like that, this step is called metastatus. Metastatus. Metastatus means the spread of the cancerous cells in the blood. So it affects anywhere in the body. So in this stage, it is highly difficult to cure because we don't know exactly where the cancer cells settles. Okay, right. So why the cervical cancer occurs? We don't know the reason exactly. The reason for the cervical cancer is unclear. But we know that it is caused by human papilloma virus. This virus creates some mutation. Thereby our cell grows abnormally. It results in the cancer. But why cancer occurs exactly, we don't know. Okay? But we know there are some risk factors associated with this. That is environment and lifestyle and food, stress, like this different factors are associated with this development of cervical cancer. Now, there are two types of cervical cancer. We could classify cervical cancer based on which cells of the cervical region gets affected. Okay. So for example, if you see, this is the cervical region, right? So this cervix has two different types of tissues. The outer layer of the cervix is made up of squamous cells. Squamous cells. Squamous cells means these are thin flat cells lining the outer part of the cervix, which projects into the vagina. So if the virus affects this cervical region, that means this squamous cells, it results in the formation of squamous cell carcinoma. Okay. So this is the common type of the cervical cancer, because we know that the outer cell region is squamous cell. So as the virus enters, it affects the outermost layer. So that's how the squamous cells, they are highly affected by this cancer. The second type of carcinoma is called as adenocarcinoma, in which column-shaped glandular cells that line the cervical canal. This is the glandular cells. This is the next layer. Okay. So these cells, if these cells are affected, it also results in the cancer. That cancer we called as adenocarcinoma. So cervical cancer are of two types depending upon which cells of the cervix region gets affected. Squamous cell carcinoma means the cells of the squamous region, the squamous cells. They are the outermost lining of the cervix. If they get affected by this cancer, this is called squamous cell carcinoma. This is the most common cervical cancer. Okay. If the column-shaped cells are affected, then that is called adenocarcinoma. So this differentiation is needed for the treatment purposes. Okay, right. Now, let us see what are the symptoms of the cervical cancer. Here we should understand that in the early stage, the cancer do not show any signs or symptoms. Even the patient don't know whether she has this infection, she has cancer in her body, because there exist no symptoms. Then in the later stage, that means in the more advanced stage only, the cancer shows its typical symptoms. So what are the symptoms? There will be a vaginal bleeding after the sexual intercourse. After coitus, she will have bleeding. Then irregular bleeding, that means apart from the normal menstrual bleeding, the woman will have bleeding from her vagina, or even if she is an elder woman, for example 52 years, at 52 years the woman will have menopause. Menopause means the menstrual cycle stops. She should not have bleeding, right? So if she has cervical cancer, she will experience this vaginal bleeding after menopause also. Then pelvic pain will be there. So lower abdominal pain will be there. That will be present all the time. And watery, bloody, vaginal discharge will be there, which will be heavy and has a foul odor. So a very bad or foul smelling discharge will be there from the vagina, which will have blood. Okay. And there will be an abnormal vaginal bleeding. So these are the symptoms of the cervical cancer, but these symptoms will be shown in the advanced stage itself, not in the early stages. Okay, right. So let us see what are the risk factors for the cervical cancer. So who will have the chances of getting cervical cancer? We already seen that not all the women will have cervical cancer, even though she is affected by human papilloma virus. Okay, so for example, if the woman has multiple sexual partners, or having sex at an early stages, that means in for example in 13 years 14 years itself, if she has sexual intercourse, she has an increased risk of getting infection. And a woman having already some other sexually transmitted infection like chlamydia, gonorrhea, syphilis, these are all bacterial sexually transmitted infection, or if she is affected by HIV or AIDS. So this, in addition to that, she has a more risk of getting human papilloma infection, which may lead to cervical cancer. Okay, these are the risk factors. Then prolonged use of contraceptive pills. What are contraceptive pills? These are the medications which the women take to avoid pregnancy. So if she is continuously taking such contraceptive pills, she will have the risk of getting cervical cancer. And people with weakened immune system and smoking. So these are the risk factors for cervical cancer. The risk factors could be one or more than one. So that depends upon individual. Okay. Right. Now let us see how the cervical cancer is diagnosed. We know that it will not show any symptoms in the early stages. So once the symptoms come in the later stages, now the woman will go to doctor. Okay, gynecologist. The doctor will look at the history and then examine through the Papanicolaou smear, that we in short form we call this as pap smear. So what is this Papanicolaou? This is the name of the person who discovered this technique. Okay, so this is called pap smear in short form. So how this is done? So this is done by a doctor, gynecologist. We used a special equipment called vaginal speculum. This is vaginal speculum. This is a stainless steel equipment. Okay, so this is used to open the cervix like this. Open this vaginal area like this. Okay, so this will be fixed with the by keeping the woman's leg widen, and the doctor will fix the vaginal speculum like this, and the doctor will insert a brush. This brush is called as cyto brush. cyto brush. Okay, so let's see here, the doctor is inserting the cyto brush and collecting the cervical cells. So the cells around the cervical region will be collected, okay, using this brush. Then it is sent to the laboratory. Now in the laboratory, histologist is the person who look after this staining or who do all this diagnostic techniques. Okay, so histologist, what the histologist will do, look after this cells by doing a smear called pap staining. So after making a smear with this cells collected by the pap smear, it will be stained. Okay, that staining is called pap staining, and it will be observed under microscope. So if it is a normal healthy cervical smear, it will be like this. See here, these are the cells of the cervix. They all almost of same size and have good sized nucleus. Okay, these are the nucleus like this. If this is an abnormal smear, abnormal sample, that means cancerous sample, it will be like this. Okay, so highly stained, the cells are large or irregular in shape, and the nucleus is highly enlarged, so like this. So by using this pap smear and pap staining, we could easily diagnose the cervical cancer, right? So that's why this pap smear is used as a precancerous screening. That means it is recommended for every woman above 30 years. Compulsorily, every woman above 30 years of age should have to do this pap smear yearly once. So this will help for the screening cervical cancer in the early stage itself. Okay, then we have some other techniques called X-ray and different type of scanning, CT scan, MRI scan, PET scan. So these are all used to determine at what stage the cancer is. Okay, we understand. So pap smear will tell us whether the tissues are of normal or abnormal cancerous cells. But in order to know which stage of the cancer they are, we use the X-ray or the different type of scanning technique. Okay. So look at the picture here. These are the different stages of the cancer. Stage 1, stage 2, stage 3 and 4 like this. So here it looks very normal, and here the cancerous growth is there. Here more abnormal growth like this. Okay. So the pap smear detects whether the cancer is present or not. Whereas the scanning techniques, the scanning methods, it will detect at which stage the cancer is present. Okay. So the level of the cancer or the stage of the cancer can be detected. So let us see the treatment method. So what are the different treatment methods available for the cervical cancer? The first one is radiation therapy. Here we use high energy rays such as X-rays or other radiation particles to destroy the cancer cells. Okay. The second one is the surgical removal of the cancer cell tumor and also the surrounding healthy tissues. And another method of the treatment is hysterectomy. Hysterectomy is the permanent method. That means here surgical removal of the uterus is done. Hysterectomy is the surgical removal of the uterus. Okay, so it will be done for many reasons, and one reason could be cancer. So if there is a cancer in the cervix, the whole uterus itself is removed, so that the cervix is also removed here. Okay, and third method is chemotherapy. That means using powerful anti-cancerous drugs to destroy the cancerous cells. So these are the different treatment techniques, right? Fine. So let us learn how to prevent the cervical cancer. This cervical cancer is preventable at an early stage. That means we have a vaccine for this cervical cancer that we call as Human Papilloma Virus Vaccine, HPV vaccine. This vaccine should be given for young girls. That means at the age of 9 to 13 years, not after that. Before the girl attains puberty. We know that at the age of 13 years, the girl attains puberty, right? So this vaccine could be administered at 9, 10, 11 or 12 or 13. Okay. So these age group girls. So this will prevent the cervical cancer for the girl in the future. Okay, right? And the woman from the 21 years or above 30 years should compulsorily undergo pap smear every year, because routine screening using pap smear, pap test will screen the cancer cells. So if the cancer is detected at an early stage, it is highly easy to cure. Okay, so that's why women at the age group of above 21 or 30 routinely should have this pap screening every year. Okay, right? then maintaining the healthy lifestyle, exercise, and practicing a good diet, and avoiding using tobacco, because in cigarette we have nicotine. Okay, so this nicotine causes cancer, it induces mutation. So avoiding using tobacco, and preventing early marriages, and practicing monogamy. Monogamy means having sexual relationship with only one partner, and practicing safe sex, that means using condoms. So these are the some methods we could use to prevent the cervical cancer. Right? Right? So I hope this lecture is clear for you. Our next lesson will be about infertility. So if you like this lecture, like, share, comment, and subscribe to our channel, NEET Biology Expert. Thank you.